Assalamu alaikum, everyone. Good morning, good afternoon, good evening, wherever you are joining us from. Welcome to our webinar today. My name is Farhan Yusuf, and I will be your moderator for today's program. Before I, begin the program, I'd like to tell you all a little bit about Care Space, which is the initiative that has organized this webinar today. So, Care Space is an initiative affiliated with the Khoja Shia Ishnashui Jamaat Dar es Salaam that is dedicated to enhance the mental health and wellness of community members through multiple avenues, including counseling, through our care support system, awareness through our various social media awareness campaigns, reintegration, which we feel is a very important part, and we provide support through our employee care scheme and engagement. After establishing that mental health exists through our first awareness campaign that covered themes such as stigma, which we know is a huge issue when it comes to mental health challenges in real life, and Islamic perspective of mental health, our second awareness campaign focused on outlining the different types of mental health disorders. This included anxiety, depression, post-traumatic stress disorder, eating disorders, and personality disorders, looking at their various risk factors, symptoms, and the consequences on the lives of people. All of our content is available on our CareSpace social media platforms, which are on Facebook, Instagram, and YouTube at carespace.ksij. Please do look for us and do share this information with others out there. So no matter how new we are to being exposed to mental health and awareness in our various communities, it is fair to say that in some capacity we have been familiar with some mental health challenges such as anxiety and depression. Although I often say that as far as the Asian community is concerned, when it comes to mental health, we are only talking of Munjaro without really knowing what that means. However, even if we were unaware of their mental, whether we were unaware of whether these are mental health challenges or not, we've heard some of these words here and there. These we can say are the more common mental health disorders or the more talked about mental health experiences, and there are various reasons for that, because they seem to have a more sort of projection in the environment around us. On the other hand, there are groups of mental health disorders that we may not be aware of, right? Not necessarily because they are not common, they do happen quite a bit, but simply because they are less talked about for various reasons. As a result, we have a tendency to attribute the symptoms of these lesser known mental health disorders to incorrect sources than to, mental health itself. In today's discussion, we hope to have a dialogue on one of these less talked about disorders, specifically psychosis, as the title of the webinar, suggested, psychosis or Jinn struck. And by the way, the title was, something that pretty much blew up for us. The moment we shared the poster, we received a lot of feedback from different people, so it's definitely something that struck a chord with a lot of people. And we were very delighted to see that interest, and we hope we can do justice to it through this talk today. And we will be talking about how we can alleviate some of the common misconceptions and the attribution of the symptoms of psychosis to certain supernatural afflictions or things that we don't particularly understand, or some people refute to believe in. And so to be able to do justice to this very interesting webinar today, I have a panel of extremely experienced individuals in this field from their various professions. We have with us someone who I don't think requires an introduction, Sheikh Nuru, who is our Islamic scholar today. Karibu sana Sheikh. We have Dr. Zahra Nagri, who is a medical doctor and a mental health first aider, and someone who I personally know is very passionate about mental health. We also have Sister Alia Deuji, who is an integrative counselor or therapist. Right, so welcome to all of you guys, and thank you for making time today. Now, jumping right into, I know we want to have a lot of time to engage with people, hopefully towards the end of the webinar. So I'll jump, right into it. And we are ideally going to look at two issues, considering, the the breadth of the webinar today. First, we will talk about what psychosis is from different angles, from a medical point of view, from a psychological point of view, and from an Islamic perspective. And then we'll talk about support. And of course, like I said, we do hope to have a lot of time to engage with our audiences today. If you guys have any questions, please make sure you send them to us. We are live. Please, whether you're watching on YouTube, on Facebook, just feel free to send your comments and we'll respond to them towards the end of the webinar. So starting off with Dr. Zahra, so psychosis, very interesting sounding word. Can you please start us off today by telling us the definition of psychosis? Are there any different types, the signs and the symptoms?
Thank you, Farhan. Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. First of all, I would like to thank the Care Space Initiative here in Dar es Salaam for organizing this much awaited webinar tonight on psychosis and jinn possession, a common dilemma that is faced by many, especially here in the African continent. I am also honored as well as humbled to share this virtual space with the esteemed Sheikh Nuru and a qualified therapist and counselor, Sister Alia. So, to start off the discussion, psychosis from a medical perspective refers to a condition which affects the way in which your brain processes information and thereby can cause one to lose touch with reality. So basically, somebody who is suffering from psychosis is unable to tell the difference between what is real and what is not. Psychosis in itself is not an illness, but rather a symptom of an illness, which means that there is usually an underlying cause or an underlying psychiatric illness. Just like we have fever is not a disease in itself, but rather a manifestation of something else that is going on in the body. We also prefer to use the term psychotic episode to describe a period during which somebody is experiencing signs and symptoms of psychosis, and I'll explain that further in one of the coming segments. So when we talk about the signs and symptoms of psychosis, basically psychosis is manifested by a cluster of symptoms which include hallucinations, delusions, disorganized thoughts, and disorganized speech. Looking at each one, hallucinations are sensory experiences that are not seen or felt or heard by others around. And hallucinations may be visual, auditory, or tactile, meaning a person suffering from psychosis may see, hear, or feel things that other people are unable to. And this is because of a distorted interpretation by the brain through the five senses. Delusions are fixed, firm, false beliefs that are held on to despite evidence of the contrary. Now, these beliefs are usually strange and not in line with one's culture and usually do not make sense to others. Again, delusions can be of different types. There are paranoid delusions. So somebody who has a paranoid delusion constantly feels like something bad is about to happen, or that small events or small things can have significant or huge meanings. Delusions may also be of persecutory type, so belief that somebody or someone is trying to harm or plotting against the person. And delusions may also be of grandiosity, so people may believe that they have extraordinary powers or supernatural abilities, and in some cases they may even believe that they are special people or even God. Now, the symptoms of psychosis do not develop overnight or suddenly. Usually, people often show warning signs before developing psychosis, and these may include paranoid behavior, social withdrawal, difficulty in concentrating or thinking clearly, and even communicating. Psychosis is quite common. Studies that have been done in the US show that around 3% of people in the United States experience at least one psychotic episode during their lives. And every year, about 100,000 teenagers and young adults in the US experience their first psychotic episode. The reason why I mention this is because the onset of psychosis is usually during adolescence, between the ages of 18 to 24. Now, when we come to the types of psychosis, we can classify it generally into either primary or secondary psychosis. So, primary psychosis would be when the psychosis is a symptom of a non psychiatric illness, such as schizophrenia, depression, or bipolar disorder. Schizophrenia is the commonest psychotic disorder, which affects about 20 million people worldwide, and it is one of the most talked about psychotic illness. It is a condition which is characterized by distorted thinking, perception, emotions, language, and behavior. Again, symptoms of schizophrenia are the ones that we talked about for psychosis, in which a person may experience hallucinations, delusions, and thought disorders. Worldwide, schizophrenia is associated with a considerable disability and may affect every aspect of one's life, including educational as well as occupational performance. Now, while psychosis can be a symptom of a primary psychiatric illness, it may also be caused by other things. For example, sleep deprivation, severe stress, substance use and abuse, and even certain prescription medications can cause psychosis. When this happens, it is called secondary psychosis. Now, whatever the underlying reason may be, this type of psychosis usually disappears once the thing that is causing it is removed, and often does not recur if the underlying cause has been treated. There are other specific forms of psychosis, as we mentioned, use of drugs. So, drug induced psychosis is when the drugs that people tend to experiment with, recreational and illicit drugs, both those that depress the nervous system as well as those that stimulate the nervous system, like cocaine and amphetamines. An example of one that depresses the nervous system is marijuana, and it affects the way the brain transmits signals and processes information, and can thereby bring about the symptoms of psychosis. Now, most of the time, this goes away when you stop using the drug, but there is a strong link between drug use and developing primary psychiatric illnesses later on. Studies show that more than 25% of those who have been diagnosed with amphetamine induced psychosis later on may develop a psychotic disorder. And marijuana is involved in roughly half of all cases. Other types of psychosis are those due to extreme psychological trauma, for example, such as the death of a loved one. It brings about a lot of emotional changes, and it affects the way the brain processes that information. So, for example, one may see the person who has already passed away after the death of a loved one, or trauma such as sexual assault or victims of war. All these can experience psychosis. There are other organic causes of psychosis, such as injuries and illnesses like traumatic brain injuries or tumors in the brain, Parkinson's disease, dementia, HIV. All these can bring about psychosis. And another one that I'd like to mention specifically is puerperal psychosis, which affects women around the time of childbirth. So women are at a higher risk of psychosis, especially after giving birth, with around a prevalence of about 2 in every 1,000 births, resulting into postpartum psychosis. So I think that's a bit of an introduction on psychosis and its signs and symptoms, as well as the different types of psychosis. Back to you, Farhan.
Thanks a lot, Zara. And that was, you call it a little introduction, but I'm quite sure, it's quite a lot to process, but all very useful information. And I think at this point, just one thing that I'd like to add is, you talked about amphetamine, induced psychosis. And I know that, that's also very much related to chewing of mirar, right? Chewing of cat and mirungi. And many times that's something that people don't talk about. So yeah, just to bring that in as well. Thank you so much for that. So moving on to Sister Alia. Sister Alia, now you're area is more the psychological realm of these things. So can you tell us a little bit about, the risk factors and consequences? And I'm sure, I know doctors tend to talk or stay more in the realm of medicines and all that, but you're our people's person, right? You're the one who engages with the people, provides that, support beyond therapy through medication and all that. So tell us also about, experiences of a person with this disorder and their perspectives.
Assalamu alaikum, everyone. First and foremost, of course, this is a really great honor to be up here and along with everybody else over here on this extreme highly platform. So it is really a great honor to be over here. And in regards to this, of course, a lot of it has been highlighted by Dr. Zara, and most of it is pretty much the exact same thing in regards to what is psychosis and stuff. However, coming from a psychological point of view, yes, it is in terms of being a person and with dealing with people. A lot of high reasons for risk factors would be that there is no precise cause of schizophrenia or psychosis and other mental health disorders, and there could be like a cluster of other influences that could be triggering them. So certain factors that seem to increase the risk of developing or triggering psychotic events could include maybe a higher risk in terms of genetics. In the family hierarchy, if people do have had history of schizophrenia or psychosis, then there's a higher chance for them to develop those kind of events as well. Together with that, as Sister Zara has mentioned, during some pregnancy and birth complications, such as having malnutrition and exposure to toxins or certain viruses that may impact brain development, are also kind of the risk factors that are quite precise in terms of triggering psychotic events and these kind of syndromes. Also, taking mind-altering drugs during the teen years and young adulthood, as described by Dr. Zara, is mostly found in adolescence. So that kind of plays a big role onto where it usually stems from. In terms of the complications, of course, if it is left untreated, of course, together with medication, there's always another side plan for treatment. Schizophrenia or psychosis can result in severe problems that affect the way of a person's life and their everyday life in all aspects of their day-to-day activities. And complications may cause or be associated with many other factors that are day-to-day basic activities, such as just going to school or going to work and things like that. So they do tend to have a great impact on these kind of activities. Amongst the main consequences would be the key to highlight is probably suicide and suicidal thoughts, as well as self-harm and to others as well. So it's one thing to really look out for when you're having these kind of psychotic events is to make sure to be aware of these kind of thoughts that the person may be experiencing. Together with that, it could also stem upon other mental health disorders, such as anxiety disorder, as well as OCD, which is obsessive compulsive disorder, together with depressive moods, or it can lead to depression sometimes if it is left untreated, of course. Abuse of alcohol or other drugs, in our case, it's mostly in terms of the drugs, as you mentioned. We have some other things and other things that we usually use in terms of like drugs, and that we don't use probably nicotine, but other things as well. So the day-to-day aspects of life are usually mostly at risk, and that could lead to financial problems and homelessness, of course, which explains why, because you're not in your normal sense of self and stuff like that. So it can lead to isolation as well. Then can have like social anxiety as well as separation anxiety, which can then lead to other depressive moods, and it just comes in like a chain reaction to it, together with other health and medical problems that can stem out from it, because it's sort of like when somebody goes into depressive mode or when they tend to like be self-harming or suicidal thoughts that could stem into other health and medical issues as well. They are more prone to being victimized to many other forms of not only in the community, but also the way other people look at them. So in terms of like the least thing that you would want to see them like is being aggressive, which is a rare, very, very rare and uncommon factor for them. So, and a lot of misunderstandings about what it means to be experiencing psychosis is that they're usually dangerous, or psychotic is mostly used as psychopath, or misunderstood as mentally retarded. So these things are really key things to know, that this is how other people look at them as, and of course they are being judged in a different way, and as abnormal, which causes them insecurity, which then leads to self-isolation, and it just all leads up into a chain effect. And of course, the biggest culprit would be media, as well as the traditional culture that we usually have of just judging people really quickly. So it gives a brief introduction on the risk factors and some of the common complications, as well as how people see them and view them in different ways.
Thank you so much, Sister Ali. I think, one of the things that makes mental health always a very challenging discussion is just how interlinked so many of these disorders are, and that, one just leads to another. And and that's where I think that the challenge usually comes, even in terms of understanding. But thank you so much for that description. Sheikh Noor, now we come to, I think, the most difficult part and the most interesting part of the webinar today. I'm looking at the questions, and most of them are not to do with the medical aspects, but rather to do with the other not so medical aspects of this talk. So clearly you have a very interesting way to go today. So Sheikh, from your side, we would like to hear, the Islamic perspective of this disease and the other element that we have talked about in our title, being Jinn struck. So if you can tell us, provide us with a description, any information from an Islamic angle that's available for, both, I guess, sides of the coin. In your experience, are there, how much of this have you encountered in the community, and what barriers have you seen that stop people from talking about these things? And then just any misconceptions that you have heard of or in your experience helped clear, if you can help us do that tonight as well. Karim, Sheikh.
Thank you so much, Brother Farhan. Dear brothers and sisters, Assalamu alaikum wa rahmatullahi ta'ala wa barakatuhu. It is indeed a great pleasure and honor to be here tonight, having this much needed discussion or conversation. And thanks to Allah to be here to share a word or two on this very important topic. My dear brothers and sisters, to begin with, I would like to invite one and all, wherever you may be watching this program, to really pay special attention to what is being said and what is going to be said. This is the type of a program we would like to see more in our communities. And I'm going to speak, number one, as a resident alim, as a preacher who has the opportunity to visit different communities, what I see and what I hear from people who normally consult me. And I'll also be speaking as a student of psychology and counseling, and also mental health first aider. You see, Islam is a holistic way of life, my dear brothers and sisters, in the sense that it provides us with guidelines on how to go about our lives. It provides guidelines for each and every sphere of life. Sometimes you may find the guidelines are specific, and sometimes the guidelines are general. The bottom line is, no stone is left unturned, either from the teachings of the Holy Quran or the traditions of Ahlul Bayt and our beloved Prophet sallallahu alaihi wasallam. Islam, my dear brothers and sisters, recognizes health and the two types of health, namely physical and mental health. And we do have numerous discussions within the religion of Islam on this very, very important topic. Our focus of tonight is psychosis or hallucination, as you heard, which is no doubt a mental health related matter or issue, if you like. What does Islam say? If you go through the teachings of Islam, be it Quran or the traditions of the Prophet and Ahlul Bayt, you'll obviously not come across a clear, straightforward word psychosis or mental health. You'll not come across such a name directly. But there are so many terminologies used in glorious Quran and the traditions of our beloved Prophet and Ahlul Bayt, signaling and pointing to mental health related issues, including psychosis. When it comes to psychosis, Arab, you will hear them saying halusa, for instance. In Islam, you will say tawahum, for instance. Direct translation, as we heard, hallucination. Islamic philosophers discuss it also. When a person gets to a point where he or she considers what is real unreal and vice versa, it is something that requires an attention. Terminologies such as sakina. Sakina means sukun, you all know. It's not just sukun. This terminology discusses the essence and the importance of mental health. Terminologies such as hayatun tayyiba, good living. We're not talking of living luxurious life, having the best of the cars. No, we're talking of something in relation to that inner chamber or inner part of our existence. Some call it mental, some call it soul, nafs, ruh, whatever. And here I'm not talking of spirituality in relation to that, because body has its sentiment or dimension of spirituality, likewise soul and other dimensions. Now we are talking of health in a true sense of health, be it physical or mental. So hayatun tayyiba, digest it, my brothers and sisters, and expound more on this when you have time. Terminologies such as kalbun salim, healthy heart. It's not just a terminology, it's about mental health. Go to Nahjul Balagha, for instance. You'll come across terms such as piety. Not piety the way we look at it. Scholars, when they examine it, they said there is connotation of mental health in terminology piety. Likewise, charity. Charity has so many angles. One of the angles of charity has to do with mental health, my dear brothers and my dear sisters. Honesty, and so forth and so forth. And so therefore, halusa or tawahum, some prefer to call it waswas, but I'm not sure about that. And they will use chapter 7, verse 20 about it. But I prefer to say either halusa or tawahumat or tawahum. Islam recognizes it. And as you know, health assumes a central stage when it comes to the teachings of Islam. You see, Quran says, "Ala lahul khalqu wal amru." So it belongs to Allah, the world of creation and the world of order. What is world of creation? Physical body. What is world of order? Soul. So we are made up of these two major components, and our health evolves around these two. And Quran is clear, my dear brothers and sisters. ثُمَّ لَتُسْأَلُنَّ يَوْمَئِذٍ عَنِ النَّعِيمِ. That indeed on that day, each and every one of us will be questioned of the blessings given to him or her by Allah. Imam Ali alayhi salam said, one of the major blessings that each and every one of us will be questioned about is how we look after our health. Our great scholars, when they examined this tradition, they said it's referring to physical and mental health. Quran says again, وَلَا تَنْسَ نَصِيبَكَ مِنَ الدُّنْيَا. Do not forget your share of this world. Imam Ali said, one of your shares in this world is looking after your health. So to cut long story short, mental health, or to be specific, psychosis is a reality. It's not a myth. It is something I and you need to pay attention to. Now let's go forward. I've been a preacher, if you like, for a good number of years. And as I said, I've been to so many communities. And I'm going to be open with you, my dear brothers and sisters. Some years ago, when people would come to me, share, I hear voices. It's like someone talking to me. The first thing that would come to mind is, this is Jinn. Because I'm from West Africa. I had something to do with jinns before while growing. I was taught about them when I was very young. And so when I had the opportunity to go to house, I came back, people would come to me. The first thing was, this is Jinn. Can I help you to remove it? Sometimes I would do whatever I could and still the person not cured. It was only later on I realized, no, Noor, you are making mistake. This is mental health related issue. Do we have this in our communities? Yes. Yes. First example, not long time ago, a youth from our community came to me. Sheikh, I've got Jinn and I need your help. So what's the problem? What's going on in your life? I can't sleep. I hear a lot of sound. Sometimes I'm confused. I don't know what is real, what is not real. Sometimes when I speak, people laugh at me. And someone told me, you are able to remove jinns. Why don't you help me? Sheikh, no. By then I was a bit matured, understanding mental health here and there. So I said, you know what? To do justice to this, go knock the door of your GP. Go talk to your GP first. Once that department is exhausted, then come back to me. I will also try my level best. Oh, he tried to negotiate with me. I told him no. So I became sort of his enemy. He wouldn't talk to me anymore. He would greet me from far. Only after 1 year, he decided to go and knock the door of his GP. And his GP referred him to specialist, mental health specialist. He was given medication. He started using this medication for some months. He came back, he became normal. He even got married now, and he has children. Today, I'm like his best friend. This one example. Another example, someone came to me from one of our own communities. Sheikh, I hear a voice that I'm going to be the wife of Imam Mahdi. This is serious. I said, hey, Banda, what's going on here? Yeah. And all of a sudden, the voice said, no, Imam Mahdi is married to another woman, but you will be another woman of Imam Mahdi. Then I said, but how often do you hear this one? Said every now and then, different voices altogether. I will be talking to myself and I'll be hearing the sound. I get confused and I will be crying. My family told me you have a jinn. Go to someone to help you. I went to so many sheikhs. A'amal, ta'awiz, a'amal, sheikh. I'm coming to you, although I'm not sure. I'm just coming to you because I've exhausted my energy. I told her, no, mommy, this is not how we do it. Go to the doctor, speak to your doctor, open up with your doctor, and tell the doctor. Then, inshallah, the doctor will be able to help you. Today, she is on medication and she's doing fine. And no one laughs at her. So this is real. We've got young children that I came across in our communities of 15 years, of 17 years, who would hear sounds all over. and their parents will call, he's got jinns. Mu'minin and mu'minat. Quran talks about jinns. We are not saying there is no jinn. Jinn is there. Jinn is one of the creatures of Allah Tabaraka wa Ta'ala. They've got choices the way we have choices. And they've got responsibilities the way we have responsibilities. True. Allah sent prophets and imams to go for ins and jinn, no doubt. Jinns, they've got certain powers. We also have our powers, but their powers can be higher than our powers. An example, for instance, chapter Naml talks about Sulaiman alayhi salam and the throne of Bilqis. That is the power of jinn. Jinn went and brought it within a twinkle of an eye. Quran says, "Ifritum min al-jinn." Likewise, before the coming of the prophet, jinns would go and spy. However, there is a discussion between scholars whether jinns are able to possess a person or not. Some are of the view that jinns are able to possess, and others are of the view that no, they can't possess. What they can do is they can cause erratic behavior in our words, in our actions, in our movements. But what I can tell you is most of these cases or challenges that we go through, they are not jinns. Because jinns normally like a serious mountainous area. Where mountains are, they like going there. And only mountains. They like that area or those areas. Number two, they also like a place like deserts, for instance. And excuse my word, like the old, type of a toilet which people used to have before. But otherwise, I believe what some of us are going through is psychosis, it's not jinn. This jinn can cause mayhem. I'm not saying they cannot cause mayhem. But what we are going through is psychosis and not jinn. And I've proven this. Whenever I advise someone to go and see his GP, the person would come back with results. The person would come back happy. So there is this misconception within our communities. And I personally believe the misconceptions are as a result of lack of programs like this. And that is why I believe this program organized by Care Space under the auspices of Dar es Salaam Jamaat is one of its kind and it's a step in the right direction. This is one reason for misconceptions. People don't have knowledge about it. They will hear the mother, the father, the brother and sister, jinn, 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 jinn. Jinn is causing me problem. Jinn is causing me problem. No, knock at the door of your GP. The second reason for misconception is what? Or misconception is what? It's a taboo subject. We don't hear people talking about it. As I said, this is a step in the right direction. At least we have qualified members of our community when it comes to this field. Dr. Zara is here. Dr. Ali Adeoji is here. Brother Farhad, who is very, very interested in this, is here. And we have others out there. So it's sort of a taboo subject. But in Islam, there is no taboo subject. We have to talk about it because our young and old are suffering from this. Another misconception is what? No, whoever is having this is not religious. They are not praying salah, no ziyara, no, tabarruk. That's why, it has nothing to do with that. During the lifetimes of Ahlul Bayt, there were companions of Ahlul Bayt who went through this type of a situation and they would consult our imams. And imams would advise them on how to go about it. So this has nothing to do whether you love Allah, you don't love Allah, you are worshiping, you are not worshiping. No, it's a reality. If you want to enjoy life and you have a good life, seek help. And last but not least, really, reason for all these misconceptions that people don't want to accept. Some are of the view that no, we are allowing non-Muslims to impose their ideas and ideologies on us. So this mental health, this psychosis, where do you get it from? It's somebody sitting somewhere, manufactured it, and they're going to impose their ideas on you. So to cut a long story short, psychosis is a reality. And I'm really excited and happy that for the first time in our community, this subject is being discussed. And who is discussing it? Members of our community. It means there is going to be light at the end of the tunnel.
Thanks a lot, Sheikh Noor. You know, it's always, I think hearing these real life stories always has definitely a bigger impact, and we need more of those. I saw a comment as well that, you know, more people need to come up and share their stories, you know, stories of healings, stories of seeking the right kind of help and the impact that that has had. And that is not just a conversation actually, you know, within just our community. I tend to be very active with, you know, global mental health discussions, and something like this was actually happening, a discussion on psychosis this month itself that was talking about putting psychosis on the global mental health agenda and making sure that more people are telling their stories. It's a problem that's, you know, not just, and I think even when we you know, shared the poster, we realized that again, this is not even a problem that is being faced only in Islam. You know, every religion seems to have its own you know, version of jinn, of possession, of, you know, some kind of supernatural element. So it's really a conversation that, you know, sort of is across or beyond all these different areas. So thanks a lot, Sheikh. I think, you know, keeping in mind the time and just moving on to, you know, the other major element. So of course, one thing we've already said, that a way of supporting people would have to have more of these conversations and, you know, try to remove the stigma. But, you know, Sister Alia, again, in your experience in the psychological elements, how is it that we can help people recognize and, you know, determine next steps, and how is it that psychologists like yourself can assist in this process?
So first and foremost, of course, in terms of the coping mechanisms, in terms of how we can support people who are experiencing psychotic events, and of course, having any kind of mental disorder as serious as schizophrenia or as psychosis, it can be both challenging for the person who is experiencing these conditions as well as for friends and family surrounding them. So there are a few ways in which, as psychological point of view, we can help them cope and support them in various ways. The first and foremost is, of course, psychoeducation, in terms of like learning about these mental health disorders, not only as an individual or as a person who is actually suffering from it, but as in terms of as a community as a whole. It's one way to move a step forward at a time, to get the whole bigger picture into getting things more knowledgeable, of course, about it. And the most important thing is like education about these orders can help the person understand the importance of sticking to a treatment plan that's given to them by their GP as well as their psychologist. And it also helps their friends and family understand the importance of having this knowledge, and to be more compassionate and understanding of the person, and to understand how they may be feeling. Secondly, would be, of course, staying focused on the goals, because many a times is when people do undergo treatment plans, it can sometimes you need the push, you need the motivation to keep going on, and that is the most difficult part for any individual who is suffering from any mental disorder. So having that focus to staying on the goal, on the treatment plan, is one of the key factors that makes it possible to attain results. Secondly, would be, of course, to have social services platform and people and support groups around the community and for the community members as well. So in one way to cope up would be having support groups, telephone line, helplines, emergencies and stuff like that. And have the most important thing is having people to talk to. And many a times people shy away and telling them about their experiences because of the stigma that was mentioned earlier, of course. So due to the stigma, there is no platform that's actually comfortable and free for them to express themselves. So having that kind of a platform and open space for them to do so is one of the key ways to kind of help them cope as well as make them feel better. In terms of the psychological point of view, there are many interventions that could be used in one-to-one interventions with a therapist or a counselor or a psychotherapist. And amongst the key points would be CBT, which is cognitive behavioral therapy. And interventions like these are key to it as well, because it not only helps you understand your thoughts, your feelings, and your behavior, but kind of gives you an insight on where it stems from. You could also have it integrated together with family intervention. So while you're working with a client or a patient in terms who are like having psychotic events, and you want to give them like any kind of homework or any kind of task to do, having it together with the family intervention is very, very beneficial, because not only you are dealing with the person itself, but rather the family and friends who are surrounding them, to make sure that you stick to the plan that's been given to them. So of course, these are the few things that are there, of course. Another thing is like CBT is like a form of talking therapy, and the main aim is to be aware of the signs and your thoughts and feelings and behaviors when they're changing. Keeping a journal in regards to it, how often you may have these psychotic events, where how do you feel about it? What do you experience? Do you feel anything physically, or is it just something mentally? What did the voice tell you? What did the voice sound like? These are key things to look into it, and then move a step forward to it when you're using these interventions, of course. And of course, it's also CBT gives you an insight on how to cope up with your symptoms. So as it's mentioned before, it kind of deals with the way you change your behavior to your perception, as well as your feelings. So it gives a balance of your emotions as well. So it can give you a good indication of where your symptoms are and how you're coping with them, and if there needs to be any way to reduce the stress that you're feeling in regards to when you're experiencing these kind of symptoms, and of course improving your overall functioning. And of course, when you're doing family intervention, it's like you're kind of not only psychoeducating yourself or the person who is actually suffering from psychosis, but the family as well, in terms of the symptoms, the signs, what they may be feeling physically or what they may be feeling emotionally, and why, and kind of gives a justification to certain behavior that they may be undergoing, which they're unaware of at many times. And also at the same time, it also improves the communication among family members, which sometimes is a big barrier in communities like ours and many other communities as well. It's an icebreaker to kind of have that platform whereby communication between parents and children is usually more of close relationships. So it's really hard for them to open up. So having that family intervention can help break the ice, give it like an open communication flow. It's easy for them to express how they feel, what they feel, and to also reach out when they need help. And having that open space and platform, such as care space, which is a good example to have this platform in the community, it gives out an open platform for people to then reach out and seek help, as well as seek guidance from professionals, as well as medically or anything or anytime when they need it. So I think there are the few psychological interventions that could be used in terms of coping with psychosis or psychotic events that are very key to the next steps forward, to move the next step forward, of course. And for more guidelines, of course, according to the National Institute of Health and Care Excellence in England here, it's quite much showing that when you use these interventions alongside medication, there's a higher rate of possibility to cure, or not exactly cure, but kind of eradicate the higher symptoms of psychosis, and sometimes maybe be treated. And of course, the community can can support in many other ways. And I guess the first and foremost would be having a non-judgmental approach, in terms of do not judge these people. They are just like us. We're just like them. There is no difference that makes them feel that they're anywhere below us or anything like that. They're just suffering a difficulty, and we have to be open to them and be open in terms of accept them for who they are, the way they are, and of course give them the space to reach out. Make reaching out and seeking help more of a normality in the community. So I guess that is one step forward that we can do to kind of help them and support them.
Thanks a lot, Sister Alia. And again, I can see in the comments that that's what people are saying. We need to empathize, not sympathize, empathize, and really provide that support to these people. It's very important as families, as friends, as communities. So thank you for that. Moving on to Dr. Zara, is there, anything different any different kind of support that medical practitioners like yourself can provide? And are there any other steps that you would recommend people take? And I guess mostly around therapy.
Yes, so before I go into the support mechanisms for supporting someone with psychosis, I'd like to just make a note that not everyone who reports to be seeing things or hearing voices is immediately diagnosed with psychosis. Psychiatrists and mental health experts use specific criteria from diagnostic manuals such as the DSM-5 or the ICD-10 to diagnose, for example, schizophrenia and other psychiatric illnesses. And these symptoms need to be present for a specified period of time before somebody can actually get a diagnosis. When we come to medication, yes, there are medications. Medications that are used to treat psychosis are called antipsychotic medications, and we have newer drugs coming into the market with time. And these basically work by altering the effect of certain chemicals which are neurotransmitters in the brain, such as dopamine. Now, a common misconception is that if I start medication, then I will have to be on it for life, or that the medication that I take, the antipsychotic medication, may have very severe side effects. Yes, taking these medications for a very long time may lead to certain side effects, but not taking them for people who have been diagnosed with a psychiatric illness would be even worse. Supporting someone with psychosis involves several steps, right from initializing the very first conversation that we have with them, all the way to enabling a patient to lead a meaningful and a productive life. Can I just shout out to our viewers that it is important to look out for the warning signs or sudden changes in behavior in people with whom we interact on a regular basis, because early detection and treatment will significantly improve the outcome and will significantly improve the quality of life for such patients. Sister Alia has already talked about the different treatment options that are available, the types of therapy, so I'm not going to repeat those. However, if I could just add a few misconceptions that Sheikh Nuru also mentioned earlier on, because you see, these misconceptions can potentially become barriers to supporting someone with psychosis. Yeah, like he mentioned that, Sister Alia mentioned that it is a common misconception that people with psychosis are dangerous, and this is not true. In fact, people suffering from psychosis are more likely to become victims of crime and violence. Research shows that persons with schizophrenia are undoubtedly at an increased risk of becoming victims of violence in the community. They are 14 times more likely to be victimized rather than being arrested as a perpetrator of crime and violence. So these people, rather than being afraid of them, we need to protect them. Yes, a small percentage may exhibit destructive behavior towards themselves or others, but this is a minority, and these require emergency medical attention. Again, the labeling and the negative phrases that are commonly used in the community, like psychos or crazy or psychopath, these people are not psychopaths, they are sick. Psychopathy is a completely different mental health condition that is characterized by manipulation or abuse that may harm others emotionally or physically to obtain personal desires. But these people are not psychopaths. And labeling and using negative phrases like these significantly contribute to the stigma around mental health problems and actually prevent people from seeking the help that they need. Again, people with psychosis are not crazy, because it doesn't mean that if they're having symptoms of hallucination or delusions, they are always going to be hallucinating or always going to be delusional. In fact, they behave quite normally when they're not experiencing symptoms. And that's why earlier on, I mentioned that the time when they experience the symptoms is called a psychotic episode, but that doesn't mean it is experienced throughout life, day in, day out. And in fact, as we talked about the secondary type of psychosis, some of them may never even actually have another episode. Contrary to common belief, people can and do recover from psychosis and can lead meaningful lives with the appropriate treatment and support. I'll just share a study that was done in patients with schizophrenia that showed that after 10 years of being diagnosed, up to 50% of patients with schizophrenia either recovered completely or improved to a point whereby they could work and live independently, right? So when we are supporting someone with psychosis, you do not need to be a medical expert or a psychiatrist to assist a loved one or someone who is struggling with psychosis. We have to understand that what they are going through is actually quite terrifying. They are likely to be scared, they might be withdrawn, and they may be unsure on how to handle the entire experience, because disconnecting from what is real or unable to tell what is real or not can be quite frightening. Therefore, supporting them and providing an understanding of the difficulty of their situation can help them get through that episode. Secondly, as Sheikh has clearly mentioned, that we must encourage these people to seek professional help, because often somebody who is experiencing psychosis may not understand what is happening to them or the things that they are experiencing, and in these situations they may not understand that they need help or treatment. So providing them with the appropriate guidance and helping them to recognize that they need help will be a vital part of supporting someone with psychosis. Now, when we are initializing that first conversation, or when we are just inquiring about how a loved one is doing, it is important to remember and keep in mind that communicating with someone with psychosis is not always easy, because they may be reluctant to share their experiences. And in fact, at times they may seem distracted. You may feel like they're not even listening to you, or they're not interested in what you have to say, but rather they're just distracted because of the constant voices that they keep hearing or the images that they keep seeing. They may have strange beliefs that you might not agree with. They may be incomprehensible at times, or even jump between different topics during a conversation. But nevertheless, it is essential to listen patiently without being judgmental, and empathy is the key to listening in such a way. It is equally important to treat them with respect and validate their emotions and experiences. Threatening or arguing or challenging and confronting their beliefs isn't going to be helpful and may push them further away. We must also realize that if someone does not wish to talk about what they are going through, then we must respect their wishes, but assure them that we are available and we are there for them in case they decide to change their mind. If you have a loved one or a family member dealing with psychosis, one of the steps that we can take is to educate ourselves on what it is and how best we can support them. Because dismissing such patients or mocking them, ignoring them, or even worse, locking them away is not going to be the solution. This is only going to make things worse, because how we respond to people who are suffering from psychosis will significantly impact their healing process, and in fact also our ability to maintain a relationship with them. So we do not want to push them away or close any doors for them. Offering hope is extremely important. Like I said, in the study that I shared, up to 50% of patients may recover. And we must offer that hope, encourage professional help, and we must also value self coping mechanisms. These are key elements to supporting someone with psychosis. Now, we must remember that a person going through psychosis may not necessarily have access to help and support every time that their symptoms appear. And therefore, it is important to introduce self coping mechanisms. And these are extremely important because they will help that person cope when support is not available, whether these are faith based or otherwise. Since we're talking about jinn possession tonight as well, people who are suffering from psychiatric illnesses like schizophrenia will often complain of seeing images or objects, hearing voices, thought removal or insertion. So they may feel like their thoughts are not their own, or somebody is actually putting thoughts into their mind. And actually, this is very similar to those who have allegedly been possessed by a jinn. And it may not always be easy to distinguish between a psychiatric illness and jinn possession. Therefore, many studies and researches that have been done around this topic recommend sort of a collaborative approach or a hybrid approach between medical practitioners and religious healthcare workers. We cannot completely ignore the patient's cultural background. But in any case, like Sheikh mentioned, in any case of alleged jinn possession, First of all, we must rule out these organic disorders either by physical examination or doing the necessary investigations, or if there are any underlying mental disorders, then they must be treated with the appropriate psychiatric methods. But a clinician should always respect the cultural background of the patient and avoid making directly contradictory statements which come from the patient or from relatives regarding the reality of being possessed or not. Because you see, when there is a conflict between medicine and cultural or religious beliefs, it is the patient who is going to suffer. And in fact, many patients who are usually accepting, they do not refuse treatment, they are usually accepting and compliant to use the medical treatment without having to give up their traditional beliefs or cultural explanations to their illness. Therefore, many studies have shown that an inclusive and a culturally sensitive approach has been proven to be good medical practice when treating patients who are experiencing symptoms of psychosis.
Thanks a lot, Dr. Zara. And I think this is, something that I had kept to bring up at the end, but I'm glad that you addressed it, that it doesn't necessarily have to be either or, right? Like it doesn't need to be that argument or that debate. We can have a hybrid approach. I'm cognizant of time, but I think because of how interesting this topic is, I'll go over a bit by maybe 10 minutes. Shekhna, the other panelists, I hope you are okay with that. And same for our viewers, just so we can cover, a lot of, and I think a very important element is what Sheikh will now cover. So Sheikh, from an Islamic, or from a religious point of view, are there any particular, I know both our panelists have given us a lot of, next steps and in terms of recognizing, but I do see questions here that I'd like to bring up. I've seen it being mentioned like twice or thrice. So, practically speaking, how can I differentiate between the two, that whether it's a, it's a spiritual thing or it's a medical thing? Do I need to differentiate, or do we just go the hybrid route the way Dr. Zara said? Is that something that's, religiously recommended? So yeah, if you can give us, from that perspective, the next steps, and just how can someone deal with those scenarios? Karim Sheikh.
Thank you so much, Brother Farhan. Yes, I think sometimes it can be challenging differentiating between the two. And as I mentioned earlier on, Quran recognizes the existence and the presence of jinns. And jinns, we do have believers in the sense of good people, good jinns, and then we have bad jinns. Good jinns, they remain where they're supposed to be, like the way good people are. Bad jinns, no, they cause mayhem. You see, the way human beings who are bad, tyrants, go around and cause mayhem, the same thing jinns. And that of jinns can be even more extreme than that of human beings. So therefore, jinns harming is there. They do harm. They do cause mayhem. They do cause issues. But the question is, how will I know if I'm disturbed by jinn or mental health related issue? No doubt the hybrid way is the best way. But before we do that, the only way for one to be able to know whether he or she is affected with jinns or by jinns or something else is to knock the doors of the experts. Very, very important. Knock the doors of the experts. We do have Muslim scholars who are trustworthy and who know about jinns. Not someone who will tell you, jinn, give you some concoction and ask you to start drinking those concoctions. And sometimes you do not even know how those concoctions are made. Because of anxiety, because of fear, some out there play with people's emotions. So the best way to go about it is what? Knock the door of experts. And if you ask me, how do I do it? Because I do receive people coming to me, either physically or via online, asking me these questions. Month will not pass without getting more than 5 people coming with these type of questions or issues. What I do is go to your GP first. You go through physical, emotional, mental examinations. Once that department is taken care of, then come back to me. If it is within my means to help you, I will do so. If I can't, I will be able to refer you to someone who I trust. He is in a position to help you. Because you often hear from our community, no, that lady, she sees very well. She's been telling people for many years. So she told us we have jinns. And when you ask them, why didn't she give you cure? No, she just said it, sure, we have jinns, and that's it. No, someone who is able to determine whether you have a jinn or not, that person should be able to give you some sort of cure. Now, as lovers and followers of Ahlul Bayt, what is important? Can you hear me?
Sheikh, we can hear you, but we seem to have lost your video.
Oh man, sorry man, I don't know what's going on here. I don't know what's going on. Maybe let him continue speaking because of time.
Yes. Yeah, no worries, Sheikh.
Yeah, thank you, Hassan. Sorry about that. What is important is when you go to an expert and the examination is done, then you can come back to a trustworthy Islamic scholar, or no, someone who knows about the jinns very well and not taking chances to help you out. Meaning your primary focal point or point of departure should be to go to an expert. Why am I saying this? I'm saying this because of my own experience, that 80% of the people who came to me, when I referred them to their GPs, they got cured and they didn't come back to me again. But now, psychosis or any other mental health related issue, including jinns, Islam also has its own cures. But as you know, Islam will never tell you only focus on Islamic cure and ignore the other cure. It is dunya and akhirah together. So as you are taking a help from an expert, Islam also has its own cure. What is the first cure from Islamic perspective? Quran is very clear, chapter 9. فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنْتُمْ لَا تَعْلَمُونَ. Ask, okay, the direct translation they give you, they said, ask those who know. But if you look at it really, ask those who remind people if you do not know something. So ask. When you ask and information is given to you, that information will help you to make an informed decision or informed judgment. So that's number one. The second cure from the Islamic perspective is what? Is the recitation of the Holy Quran, really. Because we believe Quran brings sukoon to the heart, and Quran brings some sort of serenity and some sort of calmness. Most especially when we recite the Holy Quran while reflecting on the verses of the Holy Quran. It helps a lot, my dear brothers and sisters. Do not undermine the recitation of the Holy Quran. Allah tabaraka wa ta'ala makes it very clear. Ala bi dhikrillahi tatma'innul qulub. It is through the remembrance of Allah that hearts find peace. So recitation of Quran is very, very important. Not only that, any other form of ibadah, our daily prayers. You know these 5 daily prayers? They are powerful and they are strong tools from the Islamic perspective. We do not pray only because we want to go to Jannah. No, the prayers must help us also when it comes to the affairs of this dunya. And so therefore, it is important that we hold unto our prayers. But let me end by saying this. You reciting Quran, observing your daily prayers, doing dhikr, or any a'mal that you have, it is not independent of taking expert opinion in this regard. Together, then we'll be able to solve the problem. Jinns also has his own cure. But tonight, you see, it's not a topic of jinn. I don't want to scare people too much. That's why I'm doing some taqiyya when it comes to that. But otherwise, there are ways of curing jinns, depending on how old the jinn is with a person. But that's a topic of another discussion. We are talking of mental health here.
Thank you so much, Sheikh. And I think that last point you made was so important, because I know, some audiences are going to feel like I didn't do justice, because there are a lot of questions about jinns in particular. And I feel we may have to think about doing a separate session just on, understanding jinns. But as you rightly put, today's discussion was about, mental health. And I think very relevant points brought about by all of the panelists. Thank you so much, all three of you, for sharing your experiences, your perspectives, and your expertise with us. And I hope that this discussion today has opened the doorway to more further similar discussions. I have skimmed through the comments. I feel like we've addressed most of them, except for the ones that are more specific to the jinn. I think in terms of summarizing some of the things that we've spoken about, there's definitely a lot of room for improvement in terms of removing the stigma and taboo, and providing the right kind of support to the people suffering with these kinds of challenges. I would also like to emphasize that, as I said earlier, I think this, although our focus was psychosis or jinn struck, but as I've said, I think all they're very different religions, schools of thought that have some kind of element of possession, and I think the same principles would apply, right? If you can support people through having this hybrid approach, and through making sure that they're also getting the health related care, it would be very helpful. So really, it's beyond just our discussion today, which was in the realm of Islam and jinn. There's one comment that we had received before the webinar today, but I feel it's important to bring it up. One of the challenges that we were told, the reason why people tend to go maybe the route of these beliefs rather than healthcare, is because healthcare can be expensive. And that's true, and it's a discussion for another day. But within, I think, communities, within different sort of segments of our society, there are elements where you can get support. I mean, for our community care spaces is one such space. Do reach out, right? Even if there are these challenges, anticipated challenges in terms of cost and other things, I think the important thing is to reach out and to seek help, and then to see how you can move from that. So that's definitely something I want to bring up. And I think lastly on my end would be Shekna, and this is very much in congratulating you, because I think religious leaders, religious personalities have a big role to play when it comes to these kinds of things. And it really helps when someone like you, who has that ability to influence, uses their influence in such a way to create awareness. And again, beyond just our community, other communities as well, we definitely need to include more of our religious and faith leaders within these kinds of discussions, so that we can have a real impact. Once again, thanks to all the panelists today, thanks to our viewers. We've had a lot of engagement in the comments section. Please do continue having these discussions. We will be looking at the comments even beyond. It really helps us to know whether we have achieved what we wanted to, and also to plan future programs. I'll also like to thank the KSIJ of Dar es Salaam for their support, and of course our care team for all the behind the scenes work that has gone in. Last bit of information. So Dr. Zara mentioned something about coping mechanisms, and actually our next campaign as CareSpace is going to be about these coping mechanisms. How can we self-help? How can we support ourselves before we even ask for support externally? So please do, as I mentioned earlier, do follow us on social media, share with others, and look forward to that campaign and our future programs as well. Thank you, asanteni sana. Have a good rest of your day, evening, night. Yeah, thank you.
Thank you so much, Asante.